Oh, hey there, everyone. Andrew Franklin, and I'm here to talk about navigating boundaries in therapeutic relationships. I was seeing a client to help them resolve anxiety symptoms they were experiencing from sexual assault of a sibling. Towards the end of my time working with this client, during the termination phase, she requested that we take a photograph together, remarking that I was her best friend and it would mean a lot to her. How would you handle this request? Yet another time, I had a client that would attempt to talk about new challenges toward the end of the session. Across a couple of instances of her doing this and my time in therapy being extended with her by a few minutes, this subsequently impacted other clients on my schedule. How might you handle this? Working in a partial hospitalization program with those that had severe mental illness afforded me the opportunity to work with some amazing individuals. Some of these folks were former professors and nurses prior to their health deterioration. Many of these folks were found not guilty by reason of insanity when assessed after murdering or assaulting someone. During my rotation with the community service board that housed the partial hospitalization program, I was frequently asked questions about my personal life during mental health skill building exercises. How would you manage individuals probing for details about your life? In this presentation, we will discuss boundaries and why they are so important and some practical steps to take to navigate instances in which boundaries are at danger of being blurred or violated. First, I think it's important to specify why this discussion is so important. Boundaries provide safety and protection for the clients from being used by therapists for their personal gratification. They also help therapists to remain objective. In striving to be objective, in turn, this provides a sense of security for clients. In everyday life, when we share personal information with others, we do so with the hopes that they will not wield it against us or use it for their own benefit. We share for many reasons. We may be in a dire situation, we may be trying to relate to others, we may be in need of catharsis, we may need advice. But for many, not all, trust is a key factor that determines the extent of the share. Clients are vulnerable when they share their personal information, and they need the trust that the therapist is in the relationship primarily for their benefit. Boundaries helps to ensure that is indeed the case. When you think about boundaries, you can reflect on them as a differentiator of behaviors that are associated with the therapist role versus those that are not. You can also think about them in the context of boundaries between therapists and clients. This presentation will mainly focus on boundaries between therapists and clients. When we discuss boundaries and the different ways in which they may be laxed, we need to define the different types. A boundary extension is a slight and temporary modification of the boundary that would likely benefit the client. An example of a boundary extension can be extending the time in which you meet with the client by a few minutes, or seeing the client at a festival and giving them grace for a few minutes to talk about a pressing concern before routing them to discuss this in a session. A boundary crossing is a departure from commonly accepted clinical practice that may or may not benefit the client. For example, a therapist could be asked to attend a funeral of a client's family member, which could benefit the client or it could worsen the therapeutic relationship based on how the therapist and client interact during the event, maybe even based on the interactions of the therapist with some of the family members, if how to handle that isn't discussed beforehand. Boundary violations are serious breaches that are potentially harmful to the therapeutic relationship and exploitative of clients. Engaging in sexual behavior with the client, financially exploiting the client, and asking for more details about the client's experiences than is necessary, perhaps asking questions based on your personal interests versus based on asking to facilitate insight or gather more information to help, could be harmful to the client. There are a number of things that it is useful to have boundaries around when working with clients. In no certain order, these include time allotted for treatment, disclosure of your personal information if asked or otherwise, multiple relationships, requests for them or naturally occurring ones outside of session, a desire to invite clients to your personal events because of your core values outside of the profession of psychology, acceptance of gifts from clients, invitations to clients' personal events in their lives, sexual advances from the client or considered by the therapist because of sexual attraction, physically touching a client in a non sexual way or a sexual way, giving advice, how to handle inadvertent contact with clients, searching for your client on social media, and honoring the possible resurgence of a therapeutic relationship, even when it's over. Now, what follows is my take on some practical considerations regarding the previously stated examples as they could lead to boundary extensions, boundary crossings, and boundary violations. So, this is my take in an effort to be practical based on your upcoming clinical training or your ongoing clinical practice. One, honor your time commitments with your clients. If you are slated to meet for an hour, stick to that. If the client starts talking about new things or going deeper into their experiences toward the end, consider interjecting with approval reassurance of how important the topic is to the client. And then from there, mention that you do not desire to be insensitive, but you are limited in terms of how much you can process with them in the moment. And you can very much emphasize having a more in depth conversation during the next therapeutic interaction. In the last 5 to 10 minutes of the session, you should be clarifying homework, laying out an agenda, and discussing what the client will do after the session is over as a means of reorienting them to life outside of session. So, those are some practical considerations to keep in mind in regard to time. Uh, if you are asked to disclose information about yourself and you elect to do so, I would be sure to keep it brief. You do not need to divulge more than you need to divulge. So be more curious about why you are being asked the information and inquire about that even in the event that you do divulge. If you are tempted to disclose information without being prompted, reflect on why you want to do so and if there are other interventions that you can employ to accomplish your goal. Consider how the dynamic and treatment may shift the focus on you and be wary of possibly waxing on about your successes or strategies because it feels good to do so. Remember, you are there for the client. You can always turn the client down and emphasize that you declining to disclose because that you are declining to disclose because you really want the focus to stay on the client and their needs, but you want to make sure that you do that delicately. Regarding multiple relationships, discuss how to handle the ones that are naturally occurring. For example, you both have a membership at the same gym, a part of the same PTA, you shop at the same grocery store because it's a small community, etc. You could suggest the you first rule, in which you wait for the client to speak to you first, and then if they do, you speak and keep it brief. If the client has anyone with them, you allow the client to discuss how they know you if someone asks. If the client never speaks, though you may see them, no interaction occurs. In that way, you uphold confidentiality. If you are considering extending an opportunity to clients that would cause a multiple relationship, think about how this could be exploitative, how the new role and relationship could affect your therapeutic relationship, and if there are alternatives for the client getting what they need that do not involve you all starting a new relationship. Whether it's a volunteering endeavor or an employer, just as examples, employee relationship ruptures and strains often occur in relationships, and if it happens, it will undoubtedly impact your therapeutic alliance. Inviting clients to church, sporting events, fundraisers, etc., are a no go and most likely clearly benefits the therapist. Accepting gifts, be it food or some token of appreciation, should be reflected on with consideration of the client's culture, the value of the gift, the frequency in which the clients are giving gifts, the presenting concerns of the client, policies of the setting in which you are receiving the gift, the intentions behind the client giving you the gift. It's important in the client's if it's important in the client's culture to give gifts, the value of the gift is low, it's at the conclusion of therapy and does not identify the client, and it's okay with the setting in which you are practicing, then perhaps you accept the gift. So that's a scenario in which it may be dependent upon all the things that I just said. However, if it's expensive, frequent, the client is presenting with relationship difficulties and codependency issues, perhaps you do not accept the gift, but express gratitude for thought and have a conversation with the client about what motivated them to gift you. Let's say you get invited to your client's wedding. What do you do? This is indeed a boundary crossing. May be okay, given that it's such a monumental event in a client's life, but it's worth discussing what your role as a guest will look like at the ceremony and what you should say to guests if asked who you are. This goes, I imagine, without saying, but I'm going to say it anyway. Sexual advances should not be indulged by you nor advanced by you. Physically touching the client is delicate because you never know how a person will process that touch. Additionally, it's important to assess the degree to which you are sexually attracted to the client and what you intend to be conveyed through the touch. How will you know you have communicated what you intended through the touch? How does the role of gender expression play into your decision about touching? What is the client's presenting concerns? Anything related to touch? These are all things that you should be considering prior to touching. Giving advice may be really helpful to clients, but the timing of the advice given should be considered. You need to know enough about the client and their challenges in order to give efficient advice. Additionally, you want to make sure that you are respecting the viewpoints of your client and striving as much as you can to be collaborative. We live in the information age where you can search profiles, and that includes an opportunity to search information about your clients. It should be considered that clients share with us in therapy what they want us to know. Things they deem irrelevant or not necessary for us to know for whatever reason, they leave out. So if you search their social media information, you may possibly compromise your objectivity in the therapy space. Also, knowing that additional information may be perceived as a boundary crossing that they did not want you to engage in. Here's the thing with searching on social media: whatever information you found, you cannot unknow. Once you ring the bell, you cannot unring it. What if you find information online that contradicts what they shared with you in the therapy space? How does that affect your confidence and the interventions you employ in session if you find information online that confirms your hypotheses about their functioning? How do you determine the veracity of the information the client puts online, given that many social media profiles contain content that may not necessarily be who the person is, but rather who they think they should be or their ideal version of themselves? Just some things to take into consideration if tempted to search your client online. Therapy seldomly results in cures. In best cases, it results in people being able to regulate their minds and emotions better and make more informed choices about their behaviors based on their values. With that being said, the termination door can be a revolving door of sorts. Sometimes clients need to come back to freshen up on some skills. Sometimes a major life event happens that puts them in crisis and they need someone to help them navigate the challenges. Given this, it's best, even after months and years have passed, to not get into a new relationship with a former client or get into relationships with people that you know are affiliated, associated, related to your client. Also, even though the client may have evolved and changed, you still have a working knowledge of them, which could be grounds for accusations of exploitation, which is why you should avoid new relationships with clients. In conclusion, boundaries are real and complex issues in all therapy relationships. Boundary violations are never ethical. Sometimes we need to say, no thanks, I just want to be your therapist. However, there are times when we decide to extend or cross boundaries after considering culture, context, frequency in which we're doing this, how helpful it is for the clients, presenting concerns of the clients, etc. It's important for us as therapists to make these decisions mindfully and not do them intuitively. You have to slow down, examine your motivations and values, as well as be mindful of red flags when you are considering doing anything but emphasizing or upholding boundaries. This has been a mini presentation on boundaries. I hope that you all got something out of it. Feel free to leave a like, leave a comment, or close out this video.